Yesterday, we got into the conversation about CPR because of the tragic situation with John Travolta's son over the weekend and how he administered CPR, and we got to talking about how Deana and I don't know how to do it. Dude says it's been a while that he learned how to do CPR. So we bring in the professional, and we transform the studio into, well, kind of a hospital this morning. And with us this morning, an emergency medical technician. Say hello to Rob Livingston.
Hello.
Hello, thanks for having me.
Welcome to the show this morning, sir. Now you're going to show us how to do CPR. Now we have half of a dummy in the studio this morning, and I'm not talking about dude. I know he's short. We've got half of a dummy laying on the console in here. Now, I know you were just talking to dude here a second ago about how CPR has changed over the years. He thought it was one thing. Now you're telling us it's kind of been modified a little bit. Why don't you go into detail a little bit on this?
Yes, and first of all, I would like to say if you do run across a situation where you have to use CPR, best thing to do is call 911 to get some trained professionals out
Sure.
there.
Of course.
The first thing to do, but it has changed as far as the number of compressions that you would want to do on a patient when they're down, and the importance of that even more than given the actual rescue breaths. So seeing more compressions now, and I think when Dude took it years ago, it was a little bit less number of compressions before you would go into the actual breaths.
Yeah, because I mean, I always thought before it was like 4 or 5 compressions, then breaths, but not so much anymore.
Not so much now. It's you know, you're doing 30, and it's really you're
Wow.
not, you're
It's a
not
workout.
counting while you're doing it. That's right. You have to, you know, be
Yeah.
in shape to do it. But no, you're just really going up there. You're doing the compressions, then giving a couple breaths. You're doing the compressions, and hopefully someone comes a professional in that period of time that can help out.
Now you were saying, I'm sorry, you were saying about the reason because of the compressions. Tell us why that is, as opposed to why the breaths aren't as important in this situation.
Okay, the actual compressions are, some people think that it's actually starting the heart. Well, you're actually kind of taking the place of the heart, but it's not necessarily going to start it. And you're actually, when you start doing the compressions, it's touching the heart, and it's taking out the oxygenated blood throughout
Right.
the system. So they're actually getting oxygen, getting the blood that's just going out through the other vital organs.
Okay.
And describe this. I mean, as people might think, well, I don't want to break their ribs. I
Yeah.
don't want to push too hard. How hard do you actually do
That's
it when
always
you do
been my concern.
Yeah, and that's a concern of a lot of people, and I would be lying to you if the very first time that I did this that I had someone say you got to press down a little bit harder.
Really?
And a lot of times, I mean, depending on the age of the patient, if of an adult, even an older adult, you know, it's going to be a little bit of an ouchy situation for you when you start pressing down, and you got to do it a little bit harder, and you may hear a crack, a pop,
Oh.
and you may be concerned, but
it?
remember,
Oh,
but remember, the patient that's on the ground who's not breathing has other things to worry about than a popping of the chest. So go ahead and give your breaths, go down about 2 inches. I know it's kind of hard to do, but
Yeah.
you just give a couple of presses down, and you'll know once you get into that it's going down deep enough.
Wow.
So you're 30 compressions going down about 2 inches. And how hard are you actually pressing? Like, give us some kind of an analogy on how hard you're pressing on something.
I would, enough to actually, you know, if you were going to give a hand print, a hard hand print on your palm, I guess a paw print onto some paint, just to press it down that you would see it. And if you were ever in that situation, you would know. You would know when you got it, and if you do. But I just want to caution people that if they do hear a crack, that it's okay. You know, it's still working, and if it's not necessarily breaking the ribs, but if it
Right.
does, they have something else to worry about. Your job
Right,
is to
that's-
get blood throughout the system.
Right.
Oxygen.
so Rob, also, I mean, people want to do this, learn the training. I mean, there's all kinds of different places you can get this now. What do you suggest? Say, like, if somebody's listening right now saying, you know what, it's probably time I need to know. I've got young children, I've got older parents. You know, it's something I need to know. Where can they go actually?
Go to the website. There's great on the web. American Heart Association, American Red Cross. There's all kinds of local organizations that you can call, local fire departments, EMS. Those are great places to go. You actually get certified. Maybe you can include it on your website too.
Yeah,
You can,
that's
you
what
can-
we will do.
okay,
Yes.
you can actually get certified online, and it'll take, most classes now are less than 30 minutes.
So you can
Oh,
actually
wow.
do this online now?
You can go through the class online where they show you the videos, and then when it's time to actually get tested off, someone has to watch you do it.
Oh.
Right, okay.
Then you go to a location, they test you off, and you get your card.
I was gonna say, man, I mean, how hard do you push on the monitor?
Yeah.
Hard to know. Like that. Wow, whoa! I just broke my 3rd computer now.
Now, let me ask you this. This is a dumb question, possibly. Why do you need the card? I mean, obviously, if you just want to know how to do it, do you have to go get this card, or can you? I mean, you just want to be able to save somebody's life. What is the does the card really?
You necessarily don't need that to be, you know, I'm certified. Look at my card,
Yeah.
type thing. I mean, but for some jobs, you actually need to show
Sure.
a CPR
Right.
card, and it needs to be renewed every 2
Do
years.
babysitter? Are they required babysitters to have the training now?
I'm not totally, you know, up on
I thought I
that,
heard
but I
something
do
about
know
that.
that with some babysitters, they'll have certifications or they'll have little cards that say I'm certified in CPR,
Right.
and I know as a parent it would make me feel better if.
Of course.
Oh yeah, absolutely. Know who's watching your kids.
Well, it's like earlier, actually Rob showed us his man card. It's kind of like having that certification that you're a man's man, right, Rob?
I need that.
Yeah. Rob Livingston is our special guest this morning, EMT extraordinaire. Okay, let's just, we've got the dummy here laid on the console. Once again, not dude, actual dummy. Go ahead, you've just seen this person, or actually, maybe dude should do this.
It's up so high. Yeah, we'll do it. I'm just a short little guy. All right, hold this, Rob.
Get you a footstool. Okay, so this, you've just seen this person go down. Go ahead.
Okay, the first thing that he should do again is call 911 if
Right.
that is the situation, and then what you want to do is to make sure that they're unconscious. Maybe go up to them and say, "Are you okay? Are you okay?"
Mhm.
Rub your knuckles on their the sternum area. If they don't
Sternum,
move,
okay.
if they don't move, you know that you need to, you know that there is a problem. Yes, similar to that. and then what you want to do is you want to listen for breaths. Put your ear up to their, listen to see if they're breathing, and look at their chest.
They're not, though. It's a dummy. Obviously, you're not breathing, Rob. Okay.
Thank you very much.
He's following protocol.
Right, but to seeing it, and you want to check for chest rise, and if it's not there, if they're not breathing, they don't have a chest rise, then you would want to do CPR. First thing you want to do is a head tilt, chin lift, and for those of you who cannot see, it's really just turning the head back, and if you would lift your head back and look up at the stars or look at the sun,
Right, so
you
you
can
want to
actually
get your chin so it's pointing upwards.
exactly.
Okay.
Exactly. And then once that has been established, you're gonna pinch the nose, okay, and give 2 rescue breaths.
I'm not putting my
Nice.
lips around it.
He's a germaphobe, apparently. Okay. Well, that person is no longer with us.
And that will work. And then after you give the 2 rescue breaths, now you want to do the chest compressions, and you want to put your hands, your actual palm of your hands, right on the sternum area. To keep it simple for everyone, is just right on the sternum area. Kind of keep your elbows locked on top of the patient.
Do you need a booster seat, dude?
I like that. That's funny. Yeah. No, not so much.
And then you're going to want to give just quick compressions, just like that.
It'll go 30 times. If you're just listening at home, where we've got the dummy in here, and dude's giving 30 compressions.
Is that as fast as you can go?
It should be about 100 compressions per minute.
Okay.
So
Okay.
got to figure it's going to give a lot. And after you'd give 30 or so, then you'd give 2 more rescue breaths, and you'd complete that cycle, and then you'd go back into the compression. So in actual emergency situations, and you're giving CPR, it can. And you have 2 people, sometimes you can alternate back and forth because
Sure.
you're going to get tired while
Sure.
you're doing it.
Okay, again, like Rob was stressing, you see somebody go down and you see somebody laying wherever, 911's your first phone call, and then you find out if the person's conscious, if they're breathing, and so forth. So 30 compressions, 100 per minute you're saying, and then make sure that, what did you call the tilting of the head again?
It's a head tilt, chin lift.
And also, you had mentioned earlier off the air, if there's any spinal damage that you're unaware of, you want to make sure that you're just moving the jaw.
Right, it's called the jaw thrust maneuver. Kind of sounds funny, but you'll if for those listening, if you just take your 2 of your fingers and pull down your chin, you can feel your airway open up. So that's called the jaw thrust,
Right.
just so you're not compromising the spine.
Okay, well, Rob, we appreciate you stopping by this morning. This is kind of a impromptu little lesson on CPR, and but like you suggested, we'll have links up on the Dan Dude and Deana page. And as far as taking the CPR training, you can do it online and then get tested and get your certification, especially if you need it for employment.
Yeah, and one thing I'd like to say is even if you don't get certified, to know the compressions, go online. You can learn things on there, so you know compressions. That if you're in a situation where someone's going to need CPR, you're there, you're knowledgeable about the situation, you'd be able to help.
Great. Rob Livingston, thank you very much. Emergency medical technician in the studio this morning. We thank you for making the Dan Dude and Deana show a part of your day today.
All right, thanks for
Thanks,
having
buddy.
me.
Appreciate it.
Thanks.
It's 8:14 K105.